Cognitive behavioral therapy techniques. Cognitive behavioral therapy is a form of psychotherapy treatment that teaches people how to recognize and modify damaging or distressing thinking patterns that have an adverse effect on their behavior and emotions. There are many different ways you can execute this type of therapy. It's critical to understand how ideas, feelings, and events may all contribute to maladaptive behavior. This method consists of self-discovery and insights, which are critical components of the therapeutic process. Once you've identified them, you may learn how to reframe them to be more positive and productive. Fears and phobias can be confronted via exposure therapy. The therapist will gradually expose you to the things that cause you dread or worry, while also advising you on how to deal with them in the present. Exposure can eventually help you feel less vulnerable and more secure in your coping abilities. Writing is also a useful method of connecting with one's own thoughts. It is useful to keep note of the new thoughts and actions you have implemented since the last session. Putting things down in writing allows you to recognize how far you've come. Another strategy is to use behavioral tests in which the participant must predict what would happen before performing an activity that generally causes them anxiety. You'll discuss if the prediction came true later. Over time, you may notice that the anticipated disaster is not very likely to occur. Some progressive relaxation techniques, such as deep breathing exercises, muscular relaxation, and visualization, may be taught to you. You'll discover practical techniques for reducing stress and increasing your sense of control. This can aid in the treatment of phobias, social anxiety, and other stresses. Cognitive behavioral therapy is not regarded harmful. However, it requires dedication and desire to work on new strategies between sessions, with slow but consistent progress.